everybody a minute to get set up. Start by saying Happy New Year. And let me just talk about the purpose of today's press conference. I know that people, first of all, my name is Cindy Chavez. I'm on the Board of Supervisors. I'm president of the Board of Supervisors till next Tuesday. So I'm really delighted to be with all of you to talk today. But the point of today's press conference is to have a conversation with the public about what we're experiencing in the hospitals. And I know that people they don't want to have us wagging our fingers at you, and this is not about new rules. This is really about sharing with you what our healthcare system is experiencing and asking for your leadership in helping us as a community to address it. We know that we're seeing a continued surge, and this is critical right now because the county's busy doing two other things: getting people vaccinated and making sure that we have people continuing to get tests. So we want to continue to ask the community to get tested, and vaccines are beginning to be administered. But today's focus is on our emergency medical system. And you're going to hear today from doctors and our county council just to help everybody navigate through the next few weeks and to better understand what we're experiencing. I first want to say a very sincere thank you to our healthcare personnel. They have been complete heroes. And I'd like to introduce Dr. Ahmad Kamal, Santa Clara County's COVID-19 Director of Health Preparedness. Then Dr. Jeffrey Chien from Santa Clara Valley Medical Center's Emergency Room. Then Daniel Franklin, the EMS Duty Chief of Santa Clara County. And our closer today will be our County Counsel, James Williams. So with that, let me begin by asking Dr. Kamal to come forward.
Thank you, Supervisor Chavez, and good morning, everybody. Our healthcare system continues to be under an enormous amount of strain. Every day in our county, more than 1,000 people are diagnosed with COVID-19, and more than 100 people are admitted to the hospital every single day. This surge has been relentless, and it has not stopped, and it is straining our healthcare system to a breaking point. As of right now, patients are waiting in emergency rooms to be admitted because there are not enough beds for them. As of right now, staff are being pulled from other areas of the hospital to provide care to critically ill patients. This means that other patients who also have needs are having to go without. Hospitals are canceling surgeries. Hospitals are canceling outpatient visits. These all have effects, and we cannot have it continue. We need to all work together to contain the surge and give the hospitals a little bit of breathing room so that they can recover and go on with the other critical tasks that our healthcare delivery needs to do, including vaccinations, including testing, and including outpatient care. We know how to do this. We've done it before. We did it in the spring. It's been a long, hard winter. In many ways, January may be the hardest month for us yet, with the impact of 3 holidays being seen in the hospitals. Please, we're asking everybody, do what you can, wear your masks, wash your hands, socially distance, and avoid large gatherings. And together, we can help these hospitals avoid further strain and avoid our physicians having to make further difficult decisions when it comes to caring for our community. Thank you.
Good morning, everybody. My name is Jeff Chien. I'm the ED Medical Director here at Valley Medical Emergency Department. I'm here today to speak to everybody about what we're experiencing in the emergency department. In the ER, we've been fighting this fight for almost a year now. It hasn't gotten any easier. If anything, it's gotten harder as time has gone on. The staff is fatigued. They are tired. They are drained physically, emotionally, in every way you can possibly imagine. But they continue to stand day in, day out, resolute, to make sure that the highest quality care is rendered to every member of this community who needs it. We're resolved to get this done, but we need everyone's help. The ER is full. Folks are waiting for beds. We are getting really creative with places to see patients, and patients are suffering. COVID is no joke. Folks are struggling to breathe. Folks are gasping for breath. Some folks look like they are drowning while they're sitting there in bed in front of us. And there's a very finite amount we can do to fight this new virus. So everyone likes to call the emergency providers the healthcare heroes, the first line of defense against COVID. Folks, I'm begging everyone to help us out here because we're not the front line. We're the last line. We need everyone's support so that we can continue fighting for and with everyone here. Thank you.
Good morning, Daniel Franklin, EMS Duty Chief for Santa Clara County. As you've heard, our healthcare system is currently inundated with patients. This also includes our 911 system, and how it's impacted us is with the hospitals continuing to fill with patients. We have less beds available in the emergency departments to transition care from our ambulance crews to the hospital staff. This has increased our wait times at our hospitals with our ambulance patient offload. What this means for the public is we've had experienced less ambulances available in our 911 system because they're currently waiting at hospitals. What we are asking the public to help us with is to think about calling 911, and if you do need to call 911, think about whether or not it's an appropriate use of 911 services. Every day we get many calls into our system that are really not 911 life-threatening medical emergencies. Oftentimes these could be handled through an urgent care clinic by contacting your primary care physician and setting up an appointment. And so if you are going to be utilizing 911, we just ask that you think about it and say, okay, is this truly necessary? Or is there another avenue where I could seek care? We want to be able to have ambulances available in our system to handle every life-threatening emergency. We want to be able to take care of those that live, work, and play in our system, but we need the public's help in doing so. As you heard from our healthcare professionals, we need people to mask up. We need people to social distance. We need everyone to come together and help stop the spread. We just want you to be aware that it is also impacting the 911 system. We are going to continue to do everything that we can to help those that need our true life-threatening medical emergencies. So please just help us with stopping the spread and think about whether or not it's truly necessity to call 911 or not. Thank you.
Good morning. My name is James Williams, and I'm the County Counsel for the County of Santa Clara. You heard this morning about the strain that the number of cases and COVID hospitalizations is putting on our entire healthcare delivery system, including our EMS system when you call 911 and need emergency medical care. We are at an unprecedented level of cases and hospitalizations coming out of the Thanksgiving surge. And we are extraordinarily concerned about what might be coming in the next few weeks, cases that we are yet to identify coming out of the holidays and New Year's, and what that might mean for increased hospitalizations a few weeks thereafter, starting from what is already an unprecedented high level of hospitalizations that is putting so much strain on our healthcare system. What does that mean to people like you and me? Well, it's not just a matter of ensuring access to care for people with COVID-19, although that is, of course, very, very important. But we take for granted having access to an ICU bed, having access to a paramedic and an ambulance, having access to whatever care we need walking into an emergency department at a hospital, whether it's a car accident, a heart attack, a stroke, any other thing that might happen to one of our loved ones or ourselves at a moment's notice. We take for granted that we have access to world-class, top-notch care with all of those resources fully available. And unfortunately, right now, although we still have that world-class dedication and professionalism, we have incredible strain on the system. And with that strain, the access to those resources is inherently diminished. As a community, we know what we can do to beat back COVID-19. And as vaccination programs ramp up in the coming weeks and months, we know that the tools that we have that work today, right here and right now, and those tools are to stay at home unless you're doing essential business. And when you're out on essential business, to wear your face coverings, maintain social distancing. We know all that, but it's hard. Months and months and months in, it's hard when we're seeking the hope of the vaccinations coming in the coming months. But between now and then, we want to get there together as a community with all of our friends, all of our family, all of our loved ones. And the way we can do that is by doing what we so successfully did in March and over the summer, and once again, beating back this surge in COVID-19 cases and hospitalizations. With that, I'm going to turn it back over to Supervisor Chavez.
Great, thank you. So if there are any questions, we're happy to answer them. If you're watching on Facebook, you can text Beth Willon at 408-660-5174. So are there questions from anyone?
Can you give us an update on what's happened with Kaiser and St. Louis, and are there any other hospitals affected?
Are you talking about in terms of EMS services? I think I'm gonna turn that over to James just to make sure we're accurate about that.
Yeah, so we don't have a new update regarding Kaiser, other than we're continuing our investigation as cases are reported in, and we know that Kaiser is continuing its testing, as I think they've shared that they're doing comprehensive testing as that outbreak continues. It's a really tragic situation. And we do, of course, monitor outbreaks at work sites, including healthcare sites across the county. And look, right now with the level of cases that we have, there are a lot of outbreaks at work sites, including healthcare settings all across the county. There is a very high level of COVID transmission right now in the community. There's never been a higher level. And so we're seeing that certainly true at different healthcare settings, but at every single kind of work site that's open, there's just a large volume of cases.
You're investigating in St. Louis as well?
We are aware of a number of cases at St. Louis. They have a comprehensive testing program, all the county hospitals do, and have for quite some time. And so those do catch cases, and I believe currently we're aware of about 8 cases on the staff there.
Any other cases showing up at all at other hospitals? Or?
I don't have the exact data on that, except to say that there are regularly cases at hospitals, and that's actually one of the reasons why the federal government and the state government have prioritized healthcare workers in phase 1A of vaccination, and we're very pleased that many acute care hospital workers have already received their first dose of the vaccine. Now, it will take time for that to be effective because they need to also get their second dose, and it takes several days after that to reach the level of immunity that's been described in the various studies. But we're on that pathway for that workforce, which is, of course, extremely pivotal at this time when those same systems are under strain.
Can we have someone talk about, paint the picture of what the ICU, ER situation looked like pre-Thanksgiving and then the past couple of weeks ramping up? Compare and contrast what it was like from then till now.
As far as the number of cases is concerned, to give you perspective, before Thanksgiving and in October, we were hovering about 4 to 5 cases per 100,000 people, and now we're well above 50. It is 10 times worse than what we had before. This has been a very long pandemic, but January is by far the most challenging month we've had. And the reason we're talking to you today is that awful as it is, it could get worse. And there's no other way to say that. Right now, we haven't been in a situation where there's 2 people gasping for breath and only one of them gets a ventilator. We could get there.
Dr. Kamal, with regard to the Kaiser situation, how unusual was that spike there, and to what extent are other ERs around the county vulnerable, susceptible to the same kind of scenario?
So all the emergency rooms and all the hospitals do have employee testing programs that are mandated at various government levels. But as James said, when you have so much COVID in the community, we are all vulnerable. We're vulnerable if we're in an emergency room, we're vulnerable in the community, we're vulnerable everywhere. So clearly the way to really address these hospital outbreaks is to control COVID in the greater sense and to reduce the transmission that's happening everywhere.
Just a quick follow-up, influx of more and more patients every day, does that also ramp up the risk for health workers at these hospitals?
Absolutely. Exhausted health workers, people who are just rushing from patient to patient, people who are having to rapidly turn over beds. None of this is conducive to having the level of care that we would expect. And as you've heard today, we have amazing healthcare professionals working in world-class hospitals. But every system has its limits. We are pushing that limit right now. And we talk a lot about crisis care and surge care, and even though things like sharing ventilators or rationing ventilators are the extreme example of that, there are levels that are happening now. You're seeing it in people waiting in ambulances for hours. You're seeing it in people sitting in beds and gurneys in emergency rooms who do belong in an ICU bed. So we definitely have a lot of concerns about where we are, and we have great concern about where this could be headed.
The daily case count has.
Yeah, I just want to.
Oh, go, sorry.
Should we be finding the hospitals that are not distributing the vaccines in a timely manner here in Santa Clara County?
The vaccine distribution, sorry?
Yeah. Will you be finding the hospitals that are not distributing the vaccines in a timely manner? Fine.
You know, I think that, you know, one of the concerns that I have as a member of the Board of Supervisors is making sure that all of the hospitals and everybody who has access to vaccine is getting that vaccine out as quickly as possible. I think right now our staff and the staffs of the hospitals are working really hard to collaborate. The reason that you heard that term about finding was my concern that if in fact we find a lack of collaboration, that myself and other colleagues on the board are going to be asking our staff to be much more aggressive in ensuring that vaccine gets out using whatever means that are available to us to do so.
So right now it's just a thought, but not.
Well, right now everybody's doing what they need to be doing. If we get a sense that people aren't getting that vaccine out as quickly as we can, then we're going to be acting, or we'll be asking as a board for the staff to act. Are there any other questions? Because I know Beth has some. Oh, Kit, I'm sorry.
Yes, it seems to me, just from looking at the dashboard, like the daily case count and then the rolling 7-day average seems to be trending down a little bit. Am I crazy when I see that? And what do you attribute that to? Do you think that is just holiday sort of break time in the testing, or are we seeing some effect from the vaccine right now?
Well, I think I'm going to let James respond to that. Okay.
So the question was related to the current case counts. A couple things. First of all, we're definitely not seeing any effect from the vaccine. A very, very, very small portion of the population has been vaccinated, and essentially zero has received the second dose. So it's going to take some time. But the question was really what's going on with the case counts. We had reduced testing over Christmas and New Year's because of the holidays. Almost all testing providers were closed for the holidays. So we expected to see a dip in case counts related to the reduction in testing. And we also don't expect to see cases show up on the dashboards for at least 10 days. 2 weeks has been more typical from when an event occurs. And that's been consistent throughout. And that's because it takes time, of course, for someone to test positive, and then it takes a little time for those results to come in and show up as well. So if you put all those pieces together, I think we're not going to get a good picture of what may have happened or not happened around the holidays and New Year's, probably until sometime next week.
So Beth, do you want to go ahead?
KQED, given the state's most recent health order, hospitals in Santa Clara County expect to accept transfers of COVID-19 patients from other hospitals around the state, and county and hospital officials believe they can handle those transfers.
So the question's about the new state health order that was issued yesterday. This is an order addressing hospital surge. The state is mandating that hospitals that are basically in formal crisis care mode try to transfer patients out elsewhere in the state, and that hospitals that are not are mandated to try to accept those patients where possible. That will affect, of course, Santa Clara County as well as all other counties in the state of California. We're still learning more about how that'll exactly be operationalized, but it is dependent on the specific circumstances at each hospital as well as with respect to each individual patient. A patient transfer is an individualized determination, and so those will be made through the normal state mutual aid system.
Has county contact tracing uncovered the source of the outbreak at Kaiser, or if any patients have been infected?
So the question was about the source of the outbreak at Kaiser, and all I can say at this time is that's still under investigation.
What are some of the things the county is doing to help the hospitals prepare if this continues to rise? What are some of the practical things?
So the question is, what is the county doing to help the hospital prepare? So we have been working with the hospital since before March to prepare for the scenario we are in right now. Specifically, we have helped them with procuring PPE, so that if you remember, back in the spring, there was a huge concern about PPE shortages. We are thankfully no longer in that state where we have actually been able to procure PPE, and the supply chains have stabilized. Secondly, we have also helped with hospitals in terms of preparing their surge plans, deciding how they will ramp down some services to make sure that they can accommodate the most critically ill patients. Thirdly, we have worked with them on distributing some novel treatments for COVID-19, including antibody treatments, including remdesivir, which have helped somewhat in their ability to treat patients. And fourthly, and the most challenging, is around staffing. And that's the one thing that has been really challenging throughout this pandemic. And we continue to work with them and with our state partners in order to try to secure staffing, because that's really the rate limiting step right now in how much the hospital are able to surge. And unfortunately, unlike PPE and unlike medicines, you can't manufacture staffing in a factory. There's a limited amount out there, and we're doing our best to try to draw what resources we can and share them equitably.
Question from Bay City News: is the shelter-in-place order going to be extended, or as of right now, does it expire on Friday?
So the question is, when does the stay-at-home order expire? The order is in place here in Santa Clara County through the state's regional stay-at-home order that currently it ends January 8th, but the state has made very clear that it will be extended if ICU capacity projections remain below 15%. The state has already extended it in Southern California and Central California, and we have every indication that it will be extended here in the Bay Area as well, because the hospitalization situation has not improved since it was issued.
Other question
There's a question about vaccination distribution planning. The planning related to the vaccinations is happening in phases. So the Centers for Disease Control and Prevention has issued specific guidance breaking up eligible populations into different phases, 1A, 1B, 1C, 2. The state is developing guidance. They've already issued the guidance for phase 1A, which is what we're in, which is healthcare workers. And they're developing guidance with respect to the subsequent phases. We have to build our plans based on that directive from the state, and work is well underway to provide for that, including deep into phase 1B, 1C, and phase 2, which will be the general population. So it'll be some time since we're still in the early stages of phase 1A, but we very much know that many people in the community are eager to be vaccinated, and we are very eager to see vaccinations happen on a mass scale.
Let me respond to that one too. The board, both Supervisor Simidian and I have asked for both Supervisor Simidian and I have asked for a plan to come forward to the public, even if it's not perfect, just to respond to that point, and recognizing that if the more information that we can get out through all of you so that people understand the vaccines are on the way, when their turn will be, that we think it's going to help people feel more comfortable and confident about how, how long we're going to be suffering from COVID-19 as a community. The other thing I would just recommend is the staff has done a tremendous job of really pivoting with vaccines arriving and getting people vaccinated, and I think have done a really noble job. If you look around the country, we're a little bit ahead of everybody else, in part because we have such strong leadership from the county. That being said, on Tuesdays at our board meeting, they're always at time certain, there will be a discussion about vaccines and being able to get an update. So I would just recommend that at our Tuesday board meeting at 1 that you tune in and you'll learn more about where we are with vaccines. I'm going to let Dr. Kamal respond to that.
I know I have a few friends who come in from Alabama and Southern California. Are there plans to
The county and other hospitals in the county have been using staffing agencies, and these staffing agencies source from all over the country. So we currently do have nurses working in our county from all over the country. However, the competition for these resources is quite intense, and it's just a limited supply in general, but we certainly are looking throughout the country to try to get staffing. Yeah, the need is here right now, and so we certainly could use more nurses, and I think that we all know within California, Southern California has perhaps even a greater need right now, but there is also a state-level program of CalMat, which can help with resources as well, and we have been drawing down on that as well. But you are right in the sense that those resources do get allocated to great places of greatest need. I don't have that data with me. It's certainly something that the hospitals may be able to provide you. What I can tell you is that the wait time in the emergency room is directly proportional to what's happening outside of the emergency room. So when you have a hospital that's full and there are no beds available, that increases the wait time. So it's this continuum of care that starts, as Mr. Franklin said, from the EMS system to the emergency room, to the hospital, and then to discharge. And that entire system right now is strained from beginning to end. And that's really what's causing wait times in the emergency room to increase.
In regards to wait times that ambulances are seeing at hospitals, during the month of December, we actually have a report right now that's been posted up on the Santa Clara County EMS Agency's website. You can actually get on there and see what the average wait time for each of our hospitals were based upon what the ambulances were experienced. But we've seen wait times anywhere between an additional 30 minutes, where we even had a case during the month of December, which it took 8 hours to offload one patient. So it's been fluctuating, obviously, based upon time of day and what the hospital is experiencing. Some patients, if they're a trauma, yeah, they might be getting in very quickly. Other patients with lower acuity, lesser non-life-threatening symptoms, they may be waiting for quite some time. There's also a common misconception that if you go to the emergency room by ambulance, that you're going to get seen quicker. And I want to dispel that because that's not the case. The hospitals will triage each patient that comes in, regardless if they're a walk-in or if they're brought in by ambulance, and then they're going to be treated based upon the acuity of the care that they need. So some of our patients we've been bringing in by ambulance have gone out to the waiting room. So just to make sure I dispel that.
Follow-up question? Yes. Of the calls that come into the 911 center, how many calls on a daily basis? And also, you mentioned earlier the push to get more people to think before they make that phone call.
Yes.
So what percentage would you say of the phone calls that come into the system are cases that can be handled by calling a primary care physician or going to an urgent care facility?
Great question. So we also have a report up on our agency website, which is open to the public. Anyone can get on there. It's called, you can actually see how many transports we have done each day based upon, and also how many ambulances are being sent to each hospital. To give you kind of a figure, our current cancellation rate is about 33%. So 1/3 of the calls that we respond to, we actually do not result in a transport, but that could be for a multitude of reasons. It could be that the patient elected to have a family member drive them to the hospital. It could be that the patient didn't call 911, someone else called 911 on their behalf, and they truly weren't experiencing any medical emergency. In the month of December, we were averaging about 230 transports every day in our 911 system, and then we're averaging about 350 to 400 911 requests each day in Santa Clara County. So just to give you some numbers. Anything else? All right.
All right, Robert, did you have one last one?
I don't know who this is for. Somebody asking me to ask this question, which is, you have workers who are working at several different hospitals because of staffing, et cetera. Is that going to continue given the current outbreak that we're seeing at Kaiser, St. Louis, et cetera?
So it is true that many workers do work at multiple sites. There's really no way around that given this tremendous staffing crisis we're in right now. We need all hands on deck. But clearly every place where a healthcare worker is employed needs to have a comprehensive infection control program, needs to do testing to keep both the workers and the patients safe.
Thank you, everyone. If folks need one-on-ones, people will hang out. Thank you for being here.
We'll be going in Spanish right now. For those of you who want to sit there with the camera, we'll be beginning momentarily.
Muy buenas tardes, mi nombre es Ricardo Romero Morales, soy oficial principal de información pública de aquí del condado de Santa Clara. En esta mañana nos reunimos aquí para informarles que estamos viendo una situación crítica en nuestros hospitales aquí del condado de Santa Clara. Al mismo tiempo, estamos también tratando de seguir vacunando a todas las personas que pueden ser vacunadas durante esta etapa. También estamos trabajando para traer y siguiendo proveer pruebas de COVID-19 a nuestra comunidad. Como sabemos, primero que nada queremos dar las gracias a todo el personal médico y a todas aquellas personas que están trabajando para traerles a ustedes, a nuestra comunidad, información y también todos los recursos necesarios durante esta pandemia. Como sabemos, estamos viendo una ola de casos, la ola que empezó desde el Día de Acción de Gracias. Ahora también estamos esperando a que llegue la ola adicional de casos durante las fiestas decembrinas, las cuales incluyen días feriados como la Navidad, el Año Nuevo y también posiblemente el Día de Reyes. Lo que estamos viendo en nuestros hospitales es que como el número de casos sigue aumentando, también el número de hospitalizaciones ha estado aumentando. Lo que esto quiere decir también es que no tenemos camas en el condado. La capacidad que tenemos en nuestro cuidado intensivo, en nuestra unidad de cuidado intensivo hasta el día de ayer es del 8%, lo cual indica que solamente existe el 8% de estas camas disponibles en todo el condado para una población de más de 2 millones de personas. Lo que hemos estado viendo es que más de 100 personas al día están en las salas de emergencia esperando ser atendidos por casos de COVID-19. El tiempo ha aumentado, el tiempo de espera también ha aumentado, no solamente en los hospitales, pero también ha estado aumentando en el tiempo que espera la gente por las ambulancias. Hemos estado viendo que mucha gente ha estado llamando al 911 tratando de adquirir una ambulancia para traerlos al hospital y ser atendidos. También lo que estamos viendo es de que este tiempo ha estado aumentando debido a que se toma tiempo en proveerle a una cama a la gente que viene llegando en las ambulancias. Este tiempo puede variar desde 30 minutos hasta 8 horas, dependiendo día al día. Todos estos esfuerzos estamos pidiendo la ayuda de la comunidad. Estos esfuerzos ya lo hemos hecho antes. Lo hicimos en marzo, lo hicimos en julio y agosto. Y estamos aquí una vez más en un punto muy crítico en el cual estamos pidiendo su ayuda. ¿Cómo podemos ayudar? Muy fácil. Hay que quedarnos en casa lo más posible. Solo salir a lugares que son realmente esenciales para nosotros. Después, usar su cubrebocas. Asegúrese que si usted va a salir de casa, use su cubrebocas. También mantenga ese distanciamiento social de más de 6 pies. Y por último, diga no a las reuniones en persona. Sabemos que muchos hoy van a estar celebrando también el Día de Reyes. Entonces, por favor, les estamos pidiendo que celebren a distancia, que digan no a las reuniones en persona. Una vez más, estamos aquí para informarles acerca de la situación crítica que estamos viendo en los hospitales. No tenemos el suficiente espacio para todos los nuevos casos que están llegando de COVID-19 y también el tiempo de que puede atenderlo una ambulancia está aumentando. Lo que les requeremos recordar es que si por favor ustedes van a llamar al 911, que lo piensen 2 veces y se pregunten a sí mismos, ¿puedo atender a esta emergencia de alguna otra manera? Tal vez llamando a mi proveedor de atención médica, tal vez yendo a una clínica que no sea de emergencia, para que así podamos seguir atendiendo a todas aquellas personas que necesitan estos servicios. Muchas gracias. Por ejemplo, en el mes de diciembre se estaban recibiendo aproximadamente un promedio de 230 llamadas y ahora ya estamos viendo que este número ha ido aumentando y estamos ya en 350 a 400 por día. Sí, lo que estamos viendo es que el número de camas disponible varía día al día. El número sigue siendo muy bajo hasta este momento debido a la pandemia y también a otras enfermedades o a otros casos que no tienen que ver con la pandemia. estamos viendo aquí en el condado de Santa Clara es que el aumento de casos sigue subiendo, las hospitalizaciones también siguen subiendo. Cuando los hospitales están llenos, tenemos que buscar a dónde los tenemos que trasladar. Y eso puede ser a un otro hospital dentro del condado o fuera de la región, fuera del área de la bahía, a otra parte del estado. Es importante recordarle a la comunidad que no solamente es el condado de Santa Clara y no solamente es el área de la bahía, pero todo el país está pasando por todo esto. Así que los recursos que tenemos son limitados. Es también importante recordar que como condado de Santa Clara hemos tenido muchos recursos disponibles para nuestra comunidad, pero mientras la situación sigue agravando, estos recursos están siendo limitados. Uno de estos ejemplos también es el personal de atención médica. No tenemos ya tanto personal de atención médica. Lo que estamos viendo es que muchos otros hospitales también están pidiendo ayuda de personal médico, no solamente somos nosotros. Entonces es ahí cuando le estamos una vez más pidiendo a la comunidad que por favor se quede en casa lo más posible, use su tapabocas, mantenga un distanciamiento social y que diga no a las reuniones.
Santa Clara para ayudar esta situación que está tan terrible.
Estamos aplicando diferentes tipos de estrategias, las cuales incluyen el poder ver cuáles son los casos más críticos que tenemos que atender, cuáles son los hospitales que tienen disponibilidad de camas para poder transferir a estos pacientes ahí. También estamos viendo de dónde más podemos encontrar personal médico. Una de las estrategias que estamos usando es ver cuáles son las operaciones o los servicios que pueden ser cancelados para que así este personal pueda ser redirigido y atender a los casos de COVID-19. Pero la consecuencia de esto es que hay ciertos servicios médicos que también ya están siendo cancelados.
O sea que todos los hospitales están trabajando como unidos en esto.
Sí, como condado de Santa Clara, todos los hospitales estamos trabajando unidos para aún así llevar estos servicios a nuestra comunidad.
¿Hay un número al que las personas puedan llamar específicamente para luego ustedes hacen como el sorteo de quién va dónde?
Eso ya pasa internamente entre los hospitales, se hace una coordinación de los hospitales a nivel región y es ahí cuando se decide.
De los brotes que están ocurriendo, por ejemplo, lo que ocurrió en Kaiser, lo que también está ocurriendo en St. Louis, ¿qué están haciendo al respecto?
El caso de Kaiser aún sigue bajo investigación y lo de San Luis estamos siguiendo los estándares que tenemos, los cuales incluyen hacer las pruebas a aquellas personas que estuvieron en contacto cercano con aquellos que han salido positivos.
La comunidad hispana de que ponga de su parte.
Nuestros hospitales están en una situación muy crítica. Esto significa que si usted o un familiar suyo se encuentra en un accidente automovilístico, tiene un derrame cerebral, tiene un ataque al corazón, existe la posibilidad de que ya no puedan ser atendidos debido al alto volumen de casos de COVID-19 que estamos viendo. Entonces, por favor, les estamos una vez más recordando que por favor se quede en casa lo más posible. Use su cubrebocas, mantenga ese distanciamiento social de más de 6 pies y por favor diga no a las reuniones en persona. Gracias.
¿Crees que el condado ha hecho lo suficiente para evitar esto?
El condado ahora no solamente ha estado trabajando arduamente para seguir teniendo control durante esta pandemia, pero también ahora les estamos pidiendo, les estamos suplicando la ayuda a nuestra comunidad para que sigamos saliendo adelante. Gracias.
Tu nombre y tu apellido y tu título otra vez, por favor, por si acaso.
Ricardo Romero Morales, oficial principal de información pública del condado de Santa Clara.
Xin chào quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Ngày hôm nay thì quận hạt Santa Clara đã tổ chức một buổi họp báo để đưa đến cho quý vị những con số thống kê của Covid-19 về số trường hợp nhiễm Covid-19, số trường hợp tử vong và nhập viện. trong cái mùa lễ mới vừa rồi là mùa lễ năm mới. Kính thưa quý vị, số trường hợp nhiễm Covid-19 trong quận hạt vẫn tiếp tục tăng cao và số trường hợp nhập viện và tử vong cũng tăng lên mỗi ngày. Trung bình mỗi ngày thì chúng ta có đến hơn 1.000 ca nhiễm Covid-19 và hơn 100 người phải nhập viện. Đó là một cái con số rất là nguy hiểm. Kính thưa quý vị, số giường ICU còn trống trong quận hạt chỉ còn 9% mà thôi, tương đương với 30 giường. 9% giường ICU còn trống này đã bao gồm những giường ICU đã bổ sung để phòng trường hợp mà mình rơi vào cái tình huống nguy hiểm nhất của Covid-19. Trong số những bệnh nhân đang phải nằm trong ICU thì có 50% là số bệnh nhân phải vào phòng ICU vì Covid-19. Kính thưa quý vị, cái điều mà chúng tôi lo lắng nhất là cái hệ thống ICU, cái hệ thống phòng cấp cứu, ER room và cái hệ thống 911 là cái số điện thoại 911 dành cho những cái xe cứu thương. Cái hệ thống này đang bị quá tải. Quý vị biết không, trong những cái tuần vừa qua thì các viên chức sở y tế đã có một cái số nguy hiểm về những cái xe cứu thương. Khi mà họ đến cái phòng cấp cứu đó thì họ không có chỗ để cho những cái người bệnh nhân này đi vào phòng cấp cứu, bởi vì có những người khi mà họ gọi vào cái số phone 911 đó thì họ không phải là cái trường hợp nguy hiểm đến tính mạng. Cái vấn đề này là một cái vấn đề rất là nguy hiểm, bởi vì sẽ có những cái trường hợp mà họ, ví dụ như là họ bị tai nạn hoặc là họ bị stroke, họ bị nhồi máu cơ tim, khi mà ở nhà thì họ sẽ không được vào phòng cấp cứu nữa, bởi vì những cái xe cứu thương á, không có đủ để phục vụ cho họ. Và chúng tôi cũng có một vài trường hợp khi mà quý vị gọi vào cái số 911 này đó là những cái trường hợp không phải nguy hiểm về tính mạng, thì khi mà quý vị đến tới cái phòng cứu thương rồi thì quý vị cũng sẽ không được chữa trị, bởi vì khi mà mình đến cái phòng cứu thương thì có rất là nhiều người đang chờ để được chữa trị, và các y tá và bác sĩ sẽ đo nồng độ máu của mình, đo blood pressure để thử coi là mình có rơi vào trường hợp nguy hiểm hay không, và họ sẽ chữa trị dựa trên cái trường hợp nguy hiểm của mình. Thành ra là quý vị ơi, khi mà quý vị gọi 911 thì quý vị hãy cân nhắc về cái vấn đề này, bởi vì cái 911 chỉ dành cho những trường hợp khẩn cấp nguy hiểm đến tính mạng mà thôi. Nếu như mà quý vị nghĩ là quý vị bị bệnh thì quý vị hãy đi đến những cái phòng khám gần nhất, hoặc là quý vị hãy gọi cho bác sĩ gia đình của mình, vì những người này sẽ giúp cho quý vị chữa trị được tạm thời và cho quý vị đi qua những cái cơn lo lắng cho tạm thời trong cái lúc mà quý vị bị bệnh, và chỉ gọi 911 khi nào mà quý vị cảm thấy nguy hiểm đến tính mạng mà thôi. Thêm vào đó thì chúng tôi cũng muốn nói về những cái quy định về việc cách ly. Nếu như mà quý vị đi ra khỏi quận hạt 150 dặm, hoặc là quý vị cảm thấy là quý vị có những triệu chứng liên quan đến Covid-19 thì quý vị hãy tự ở nhà và tự theo dõi những cái triệu chứng của mình trong vòng đủ 14 ngày. Quý vị chỉ cần cách ly 10 ngày mà thôi. Tuy nhiên, để mà theo dõi triệu chứng thì quý vị phải theo dõi triệu chứng trong vòng đủ 14 ngày. Vì trong vòng 14 ngày này á, quý vị cái triệu chứng Covid-19 nó mới có thể hiện ra được trong cái người của quý vị, và khi đó quý vị đi xét nghiệm á, thì quý vị mới thấy được là quý vị có bị positive hay là negative hay không. Quý vị hãy đi xét nghiệm ngay nếu như mà quý vị thấy triệu chứng, và nếu như mà quý vị không thấy triệu chứng thì quý vị nên đi xét nghiệm vào ngày thứ 6 hoặc ngày thứ 7. Chúng tôi đã đưa ra những cái quy định về cách ly và cô lập lên trên trang mạng của quận hạt Santa Clara. Chúng tôi cũng có những cái thông tin bằng tiếng Việt trên trang Facebook của Sở Y tế Công cộng quận hạt Santa Clara là facebook.com/SCC Sở Y tế. Thành ra là quý vị hãy lên cái trang web này và lên cái Facebook này để quý vị nhận được những thông tin mới nhất. Thêm vào đó thì chúng tôi cũng khuyến khích quý vị là hãy ở nhà nhiều nhất có thể, hãy luôn luôn rửa tay, hãy cùng chúng tôi để chống lại cái con virus này. Chúng tôi vẫn đang cố gắng thúc đẩy cái quá trình mà tiêm vaccine Covid-19, và nếu như mà có vaccine nhiều hơn là chúng tôi sẽ đưa đến cho cộng đồng sớm nhất có thể. Chúng ta phải đi theo từng giai đoạn, thì cái giai đoạn ở hiện tại là chúng ta đang cung cấp vaccine cho những cái người mà dễ bị tổn thương nhất, những cái người dễ bị nhiễm bệnh Covid-19 nhất, và những cái người mà đang làm việc ở tuyến đầu. Thành ra quý vị hãy chờ thêm chút nữa đi, khi nào mà chúng ta đã có nhiều vaccine rồi để có thể đưa ra cho cộng đồng rồi, thì chúng tôi sẽ có một cái đường dây, một cái trung tâm cuộc gọi chỉ dành riêng cho vaccine Covid-19 mà thôi, thì chúng tôi sẽ cung cấp đến cho quý vị, và quý vị có thể gọi vào cái đường dây này và quý vị có thể hỏi khi nào đến lượt quý vị. Còn hiện tại ngay bây giờ thì chúng tôi chỉ cung cấp vaccine cho những cái frontline worker mà thôi. Thêm vào đó nữa thì chúng tôi cũng khuyến khích quý vị hãy đi xét nghiệm Covid-19 nhiều nhất có thể là mỗi tuần một lần để chúng ta có thể ngăn chặn được cái việc mà Covid-19 lây lan sớm nhất có thể. Hãy đi xét nghiệm nhiều nhất và hãy cùng nhau thực hiện những cái giao thức giữ khoảng cách xã hội để chúng ta có thể ngăn chặn được cái Covid-19 lây lan. Xin cảm ơn quý vị và kính chúc quý vị thật nhiều sức khỏe.
大家好，我是圣塔克拉拉县紧急行动中心的 Chang。今天的记者会主要的目的是为大家提供目前新冠疫情的最新消息，以及继续的恳请大家的协助，居家防疫，避免医疗系统的崩溃。入冬之后，加上年底的几个节日，还是有许多的民众出游或是和家人朋友的相聚，导致确诊人数大增，造成很多医院已经不堪负荷。 没有床位或是医护人员不足的窘境，圣塔克拉拉县和加州其他的县都面临了相同的状况。而这样的情况呢，可能导致紧急医疗服务，就是 EMS 和救护车在医院前面阻塞，无法及时的将病患送进医院，得到应有的治疗或是急救。一些救护车到了医院的门口，却无法将病人送进医院。 必须在医院外等好几个小时，在救护车里面继续给氧气，保持病人的生命。这样的情况对我们的医疗系统造成非常大的挑战，因为医院提供的服务呢，不光是给新冠病人的，很有可能有紧急的状况，像是车祸或者是中风或是心脏病的患者，没有办法及时得到救治而产生憾事，所以。 为了保持医疗系统的运作呢，我们希望大家如果不是有造成生命的危险的情况的时候，不要打911，可以自行的开车，或者是请家人开车送您去医院。而且去急诊室之前，可以先去其他的诊所，或者是其他的急诊诊所，因为医院的急诊室已经很多都没有床位了。 而在疫情越发严重的今天，大家自觉的居家隔离和检疫就格外的重要。有好多被感染的例子，都是因为接触到染疫的患者，而这些染疫者呢，对于自己的症状并没有太加的注意，没有去做检测，也没有居家隔离，以为只是过敏或是感冒，而不经意的将病毒传染了给别人。所以我们在此呼吁。 在疫情的期间，任何的感冒症状都不得轻忽，请一定去做检测。可以跟自己的家庭医生要求安排做检测，或是上 sccfreetest.org 网站上面去登记做检测，检测是免费的。而且就算不是新冠肺炎，如果有任何的过敏或感冒的症状，也请都不要出门，也不要去上班，直到症状好转为止。 照顾好自己就是对这个疫情最大的贡献，请大家继续的勤洗手、戴口罩、保持社交距离。除了必要的活动，请待在家里面，不要出门。更多的讯息，请上网站 www.sccgov.org/covid19， 可选择中文的页面。祝大家平安健康，谢谢。
Magandang umaga ho mga kababayan. Ako ho si Ted Gomez ng Emergency Operations Center ng Santa Clara County. Naglilingkod bilang Public Information Officer. Ang focus ho natin ngayon ay para i-highlight ang mga darating na pagsubok na hinaharap ng ating health system dahil sa pagbilis ng pagkalat ng COVID-19 cases at paggamit sa ating mga ospital. Maaari po lamang gamitin ang 911 sa wastong pamamaraan tulad ng panganib ang buhay para maiwasan ang paggamit ng ambulansya at emergency kung hindi naman po nadadapat o kinakailangan. Marami po tayong mga clinic sa Santa Clara County na pwede natin gamitin kung hindi naman po nanganganib ang buhay. At kami po ay nakikiusap at lumalapit sa inyong lahat na panatiliin
ang tama o wastong paggamit ng face mask at palaging sundin ang social distancing. At kung maaari po lamang manatili sa ating pamamahay o kung posible limitahan ng pisikal na interaksyon sa publiko o sa mga tao na hindi po natin kinakasama sa ating mga tahanan. Mga kababayan, tayo po'y magtulungan at iwasan o bawasan ang pagkalat ng COVID-19. Kung kailangan nyo ng impormasyon, maaari po lamang pumunta sa www.sccgov.org/coronavirus. At kung kayo'y naghahanap ng testing na libre, ang website to is www.sccfreetest.org. Maraming salamat.